All right, another afternoon. Here we are. I'm Katie Rammel. Alongside me here virtually, Garrett Archer. He's our data guru here at ABC 15. And once again, another afternoon of helping you dive into the coronavirus numbers, find the information you want for your family so you can make the best choices about where you're going, the errands you're running, the schools you might be sending your kids to. All of that will help you find the numbers you're looking for in the comments. As always, ask us questions. We'll help you find the data. We'll help you dive into it, help you read it, help you get there faster because we're on these websites all day long and we can just maneuver them a little bit quicker and cut down some time for you. So, Garrett, let's get right to it. We passed a pretty big number, 3 million cases in the U.S. today. So that was a big headline. That's where we rank right now. But we, of course, always concentrate on the Arizona numbers, and no big surprises in the summary from the Department of Health today. But let's walk everybody through what today looked like.
Absolutely. So. Nothing too surprising today on what we saw in the numbers. So our total case number is about 108,000. The total reported cases today was 3,500 against 12,000 diagnostic tests and 3,000 antibody tests. 36 deaths were reported today. That brings our total to 1963. So those are the summary numbers that we're looking at. Our PCR, our total percent positive for the diagnostic tests, continues to go up. And so the serology tests also continue to go up. So, we're still seeing sort of higher numbers, but we're not seeing sort of inordinately high numbers today.
Mm-hmm. And for people who want to peek at those summary numbers, it's easy to find on the Arizona Department of Health's website. Click on the COVID section. The top little icon there is summary, and you'll be able to find those each day. Those are the ones that we go through. There was a pretty big headline across the country today, one that got a lot of eyes for people here in Arizona, and that was the New York Times article. And I think we can put a link to what we're talking about there. Arizona ended up on the top of the list. Let's help people understand where those numbers exactly came from.
So yeah, I'm just showing you the article that they're talking about here. So Arizona number 1, Bahrain is number 4. So what they did here is they took this information from most likely Johns Hopkins University, as that's where most of this data is being repositoried, and then they did what's called a per capita count. So the new coronavirus cases per million residents in the last 7 days. And you can see in the last 7 days per capita, new infections, we have a higher rate than everywhere else in the world right now. And this is standardized to population. So it doesn't matter if Florida has a larger population than us simply because of that per capita calculation. So what I'm going to do now is I'm going to stop sharing this, and then I'm going to bring up a new website that we haven't talked about. And this is called 19-dvoc.com. What that is obviously COVID-19 spelled backwards, flip backwards. They say it in the title. Let's flip the script on COVID-19. So this is a visualization site for data for COVID-19, and I'm going to show you where you can actually find a way to look at these numbers for any jurisdiction in the world, really. If you go down, and you'll have to bear with me because I don't come to this site all that often, but we're going to go to all 91 DVOC visualizations. We're going to go to the global visualizations, and then you can see this is for the United States, and this is for basically countries we're looking at here. The United States is highlighted, but you can highlight any of the others you wish. If you keep going down, there is a U.S. by territory, by U.S. state and territory, and this is not taking into account an equalized population. So right now we're seeing, as you can see, you've got Florida, Texas, California, all with higher numbers on us, simply because those are much larger states than Arizona. So the one that they're using for this is right here, new confirmed COVID-19 cases per day, normalized by population. And here, you can see, this has sort of made some headlines over the last couple days. You see Arizona right here at the top of the states. In fact, our new cases are higher than what New York had at the peak of its pandemic. So we are now registering more cases per capita than New York did at the peak. Now, of course, there's differences there. The infections that Arizona is registering are significantly younger than they were in New York, and so there's things to be taken into in this. But regardless of that, this is equalized to population. So no matter how you want to interpret this data, it still shows that we have the highest per capita rate in the country right now, and as well as the world.
Garrett, show us again on this website. I know the address is still up there for people who want to bookmark it or write it down to be able to get a closer look at it each day. But right there on that site, you just scrolled about halfway down. Is that the main page, the launch page?
Yeah, this is to look. This is you go to. I'll just start from the beginning again. You want to go to all 91 DVOC visualizations first, and then go to global COVID-19 visualizations. As you can see, there's other visualizations you can look at, but I'm specifically talking about that New York Times article. And these first graphs are not normalized to population, so they're going to be taken into consideration the size of the country, the size of the state. And then you come down here to normalize per million, and this is where you'll sort of see, what's going on with, the country as far as, it doesn't matter how big or small the state is.
Yeah, I think it's helpful because a lot of people who might be thinking about traveling somewhere else are able to look up either where they're from, where their friends and family are, and they can sort of check on how the numbers look there.
And this will also show, just so you see, there's other options too. You can see that normalized by population, there's where our testing is compared to the rest of the states. So there's other options you can look at in this data as well to see where we are. So anyway.
Really interesting website. Who put this together?
I'm not exactly sure who put this one together. I've known about it for a while, but I haven't really looked into who put it together. But I know that they're using the Johns Hopkins University data, which is the sort of the gold standard for the data. So
yeah, it certainly has been since day one. One of the questions coming in, and a couple of people have asked. So I saw Michelle had just asked this. Several people had asked about the deaths. I'm assuming you're asking about the number of deaths in Arizona. The current number, we're approaching 2,000 at this point. Oh, and of course my screen won't load, but it looks like, was it 1963? Is that what we're at? 1,000?
Yes, I believe 1963 is the number, yes.
Yeah. 36 reported today. That does not mean those all just happened in the last 24 hours, but 36 were reported today. We're closing in on 2,000. So hopefully.
I will bring up the curve so everyone can see. This is the actual date of death for the curve, and the light blue is what was added, or in some cases moved or subtracted. These numbers were subtracted from these dates and either moved out of Arizona or moved on to a different date. And you can see right here that most of the deaths did occur in the last 9 to 10 days, with a few of them coming out after that. But this yellow moving line here, this is the 7-day rolling average. So you can see how, deaths have increased over time. Although, you're looking at, this is the scale here. So now we're at about, it looks like we're at about 20 something in the rolling average on deaths per day.
Yeah, the two highest date deaths at last check were June 23rd and June 25th. Is that still?
Yes. Yeah, you can see it right there. It's still right there. This is
was it 38 people we lost on those days?
I believe so. I'm not looking at it right now, but that sounds correct.
Yeah, that was about the last number we had. Geez, lots of questions coming in, and we thank you for all of you for joining us on here. We hope that we can help you find the information and teach you where to find it so that you're able to look up those numbers. In a newscast each night, we only have a half hour to get to all of those things, and there are certain metrics that people like to find and like to look at. So we just want to teach you where to find those so that you can make the best choices for your family. Garrett, what other numbers were you watching today that kind of caught your eye?
So one of the numbers that I'm watching today is we're sort of, the vice president and Dr. Birx came on today and talked about the sort of some of the positive news that they're seeing coming out of Arizona as they see our curve is starting to slightly flatten and emergency room visits are down. So these are numbers that I've been looking at today. What I can say is that in terms of the number of cases and tests that we are doing, we are seeing a sort of plateauing of cases and tests from last week. That does have a factor in that plateau is the number of tests being processed. So that is one of the reasons why we are seeing a plateau in our cases right now. However, even with that being said, we are seeing a slightly lower percent positive of these tests. So I'm going to share my screen one more time. This is the percent positive tests. And what you're seeing here is that obviously this is a very noisy line. You can see it going up and down all over the place. But this yellow 7-day rolling average is sort of picking up and trying to figure out where this is smoothing to. And you can see right here we're at about 25, and this is the actual date. But we're seeing sort of, if you look at sort of how this is starting to curve down. It's beginning a downward curve. We don't know if that's going to stick, but we are starting to see one. I mean, one of the other things we saw in this respect is we saw our first days, July 3rd and July 4th, are the first days in which we saw under 20% positive since first, not on this graph, of course. This is calculated slightly differently, but had our first kind of percent positives July 3rd and July 4th since I think June 23rd or something.
Wow. And Garrett, is that graph shareable? Is that one that you've put out on Twitter or where?
No, but I will share what I just talked about so you can kind of see it yourself. So I'm at the AZDHS dashboard. Mm-hmm. I'm going to go to laboratory testing, pardon me. And then I'm going to take this and I'm going to this total positive PCR test. This is the diagnostic test. And I'm going to push this little plus button right here. And this brings it all to the daily numbers. And these little red dots, a little hard to hover over, but you can still do it. This is what the percent positive of those daily tests were. And these numbers are very high, but you can also see the testing is extremely low. And we expect these numbers to drop considerably. But you can see right here, July 3rd and July 4th, there's a considerable number of tests, 6,500 and 8,000 tests. And in both cases, we're under 19% on those. You can see, obviously, we're expecting to have a lot more tests. But because, as you can see the way this works, we're expecting these numbers to drop. These numbers we should also expect to drop slightly too. So the fact that they're not all the way up here where we're at 19,000 tests here. And so as I said, it's very difficult to hit the thing here, but about 23% positive. But we're already seeing 19% right here, and we're hoping that that number drops. So, these are sort of what we're talking about when we're saying there's some, signs coming out that we might be hitting a peak here.
Yeah, or at least a plateau that we could kind of move through this and
yes.
to see the next bit of change in all of this. AZ Card just asked this question, and first of all, I know so many questions are coming in. You guys, they're coming in so fast I could barely read them and listen to Garrett at the same time. So I apologize if we're missing some of them. We'll get back to you. But AZ Card was just asking, how many hospital ICU beds are only COVID? There is a full COVID breakdown in Arizona and in Maricopa County. And I see, Garrett, you're pulling that up. And AZ Card, this is how you can take a peek at this for yourself. These are hospital COVID-19 specific metrics. And as Garrett hovers over that number, you can see the exact number. And Garrett, your eyes on your home screen are going to be a little bit better than me looking through a smaller.
Yes, it's a record high today at 871. But as you can see, sort of the slope from the last couple of days has started to slow down, which is it's still too early to maintain a trend with only 2 or 3 days. But the slope here is somewhat encouraging. This comes out to about 52% of all occupied or all beds, not occupied, but 52% of all ICU beds, licensed beds in Arizona are occupied by COVID-19 patients at this point.
Yeah, and you can get into even more specific numbers in there. I know that 570 Arizonans right now are on a ventilator, and those numbers are right there on that pull down bar as well. So AZ Card, if you want to look even closer at some of those numbers, see each day how things are changing so that you can make the best choices for your family and your life, this is exactly where to find it. Once again, it's the Arizona Department of Health website. Okay, Nick is writing in, will they get to recoveries? WTF. So you're frustrated, Nick. I hear you. We are too. There are no there's no set definition for a recovery. So we kind of go over this every day, but I want to make sure we do go over it every day because I know it's important to people. There is no agreed upon definition for recovery. So what looks like a recovery to me might not look like one to Garrett, might not look like one to you, Nick. So because there is no agreed upon definition in all of this, the best number that we can pull for you is hospital discharge numbers. And we all know once you leave the hospital, it doesn't mean you're 100%. And that's why these numbers are hard to go by, but it's the best number that we have for you. And those numbers can be pulled from covidtracking.com. And I took a peek for you today. It's at about 12,262. That's the very latest number. And Garrett, we'd love to give Nick a better answer, but there's not a definition set by anybody yet, because this is such a new virus as to what things might look like, how a recovery might be defined.
Yeah, there are, as we've said before, there are counties and some health departments across the country, state health departments that have settled on what they consider a definition. And a lot of times those definitions have to do with the length of time that a case has had the virus. In some cases, it's 2 weeks. In some cases, it's 27 days. And so there are some states that are putting out recovery numbers. In fact, even the Navajo Nation is putting out recovery numbers. They were at, I believe, 5,600 out of 7,200 cases recovered, what they define as recovered. AZDHS has not put out a recovery number yet, so we don't have anything solid as far as their definition. I did run some numbers today, and it looks like based on the past number of cases we have, we would be somewhere in the range. If we were using, say, like a definition of 27 days would be considered recovered, we'd be around 30,000 or so recovered. But again, that's just an estimate.
Yeah, and recovery dates, if there was a date assigned, it would probably have to be a different date for a different age group as well,
Yes.
because the way people are recovering from this is so very different at this point. Mindy, I want to touch on something Mindy just wrote, and she's absolutely correct, that even if you take 8 positive tests here in Arizona, you are counted one time. They work to deduplicate these tests and make sure that that you're only counted once for your positive test. So I wanted to agree with Mindy and say, yeah, you're absolutely right.
Yeah, I spoke with AZDHS on this yesterday.
Wow.
They have a back-end system called MedSys, which is what they use to input all this data, and they've been using it for years for other things.
Mhm.
So this is a case system. This is for patients. So when someone tests positive and they become a case, then they have private information, so social security numbers, other identifiable information that's put into this MedSys system. So if someone is tested positive a second time and a social security number comes up that's already in the system, it's bouncing out. They're not putting that case into the system.
Yeah, so that helps to kind of have people feel a little bit more confident in the numbers that they're getting. This viewer writes in, my friend's husband is in his 40s, passed away this week from COVID, and another friend's husband in his 30s is so very sick from COVID. This is exactly why we're on here talking about this, because these are real stories affecting real people in our community. So we just want to help people find the info. That's all it is. Find the information there. And I'm thinking of your family and your friends, because this is not a fun thing to experience at all. I don't know about you, Garrett, hearing of these people having to say their final goodbyes over speakerphone. If you have ever had to do that in your life, you will never forget it. I think that's one of the reasons driving me in all this. I've had to do it once. It is awful. What other numbers have you been watching?
So those are sort of the major numbers. I will put in one thing, because we had the U of A had a press conference today and talked about the overall infection rate in Arizona, and this is using modeling. So this is using epidemiological modeling. This has nothing to do with what is reported by the AZDHS, except for just using that to tighten the models up. But they say that about in total, about 3 to 5% of Arizonans have likely had the virus, and that our current infection rate is probably anywhere in the range, this is active infections, is probably around 1 to 2% of the population right now. And that's with about 7 million people. So they're talking just under 1 million people in Arizona are walking around with the virus.
That's some incredible numbers. University of Arizona was saying that this morning?
Yes.
Wow. All right. I want to get to some more of the questions that are coming in, and like I said, so many are coming in so fast. I'm trying to read through them today. We appreciate all of you taking time with us, and we hope that we're able to help you find a lot of this info. Our website here at ABC 15, that's got the whole coronavirus section. So if there's some other information we haven't touched on, you can go to abc15.com/coronavirus coronavirus. Once again, abc15.com, and then the coronavirus section is there. We also have a full section on education, and there is an interactive map there. So you can highlight over your school district, your kid's school district, and find the very latest info on what their plans are for back to school, how they hope to implement these procedures for getting our kids back in the classroom, and what each one is doing, because each school district is different here. So that's the easiest place to find information. And also, we have a reporter completely dedicated just to education, and that's Danielle Lerner. You can find her on Twitter as well. And their producer Carrie's so good; she's all over it. At Danielle Lerner is her handle, and you can find the very latest info on school plans and what they're kind of talking about and the latest things out there. So, lots of questions coming in. Garrett, did you see one?
I did. I saw one. Someone wanted me to mention something about Yuma. So I just wanted to do a quick screen share here of the county growths. As far as where is Yuma sending COVID patients, the answer to that is we're not 100% sure, but it's likely going to be Tucson. And they've already said that they're not sending community members over, but they have sent other people over. But as far as Yuma is concerned, we can see here that right now they have an infection rate that is slowing. It's at 20 days to double. It was back here where the curve is much more aggressive. It was at about 2 weeks at that point. So, and you can see this is indicative of all of the southern border counties. They've all begun a slowing period. About 2 weeks ago, this was the hot spot in Arizona, and they have all started slowing. In fact, everybody's slowed a little bit. This used to be 14 days, 12 days, or I think it was 13 days, I think. So it's slowing a little bit, but as you can see, Maricopa, 15 days double. One of the largest, obviously the largest county in Arizona, is concerning that it's still at 15 days doubling. We want to see that number go down. Just to show you as case per capita, you can see that the two hardest hit counties still are Yuma and Santa Cruz at this point.
Can you click on Yavapai? Cheryl was just asking, what about Yavapai County? Cheryl, I see you wrote, and I might have missed one of the questions before. So let me know if this is not the data that you needed specifically, but we can zoom into that and give you a better look at Yavapai.
So Yavapai has had a very interesting experience here. As you can see, there's a lot of these really flat lines for Yavapai, and then these spikes, and then another flatter line. They've started a sort of a period of slow acceleration. They're at 16 days doubling right now. That's actually quite fast for Yavapai. They're normally in the 20s. So we'll see what happens. But they've had a very kind of it's come in shifts. I know they had a very big infection at a Mingus Mountain Academy that really this up here right here that really pushed their numbers up. But it's sort of come in these kind of three waves there, where it stopped and then started again and then stopped and started again.
Garrett, a lot of people have been asking about zip codes, and I want to show them how to find the zip code map, because if you are nervous about getting to the wrong site, this can kind of feel like you're going on the wrong site. Because when you go on to find this, everybody, to go on Arizona Health Department's website, when you click through, you're going to click that zip code icon. Garrett, thank you. It's going to take you to a little bar that almost looks like you're going to the wrong place. So that's it. You do need to click through it to find your zip code. And specifically, Garrett, the question I'm asking, or the question I'm getting from a viewer is about the hottest zip code in Pima County. The tough thing about reading these zip codes right now, everybody, is because these the graph that they're using now really has everywhere filled in red. So they almost have to adjust the graphs so that we can see the difference between different hotspots. As you can see, a lot of it is just filled in with red now. But are we able to get a closer look at Pima County and some of those?
Yeah, I pulled it really quick. Hold on a second. Someone's calling me. Stop calling me. I pulled it really quick.
Don't they know you're busy?
The postcode is 85706. That is the most impacted in Pima. There's 1,307. With Maricopa, I'm actually quite good at finding the exact zip code, but I'm not as good with that in Pima. I'm going to presume it's this one. Nope, it is not. It is not. 85706. There it is. Right here. I believe Is this where Tucson Medical Center is? I'm not 100% sure, but this seems to be the most impacted zip code in Pima right now.
Yeah, and that is of course one of the factors if a healthcare facility is right there. So
yes, having a healthcare facility in the zip code can increase the numbers, because there are going to be certain circumstances where patients that either live outside of jurisdiction or just haven't had their information collected yet are given the zip code of the hospital for now. So
I don't I'm not the hugest fan of the zip code map. I have
no.
several people in my family who really like the zip code map. It is helpful if you want to track your neighborhood, but you really have to know, exactly what's in your whole zip code, because if there's a home that had an outbreak, or if there's a and like a group home or an assisted living facility where they've had an outbreak, or a hospital, different things like that can affect your numbers so much. There is a way to look back at how much things have changed in your zip code, but because there's no set population in each zip code, I don't love the number as much, but I know that it is helpful for people to look at. So we're getting so many questions to look up specific zip codes, and I wish we could go through every single one of them, but that's where to find it. Just go to the Department of Health website, click on that zip code icon. Don't be freaked out by that link, because it doesn't look legit, but you click through it and then you'll get to a page, and that's exactly where you're supposed to be. Hover over your particular zip and then you'll be able to see what that looks like. Chad is saying the death rate in the US is 4.4%. That is correct as of today. We have 3 million people in the United States with cases, and we've sadly lost 132,000 people, but that is where the rate stands exactly today. And Brian wrote, just asked if we do this each day. Brian, we do. We try to hop on here and help you guys find the info that you need. This is specific to Arizona. I know that there are people on this page following all across the US and the world, but the numbers that we look at closest are here in Arizona, because we cover Arizona. It's the websites that we're most familiar with, so we can help you jump to the info instead of you getting on there and taking too much time, being interrupted by your kids and everything else that's happening in your life. So we just want to help you dive into the numbers and get the very latest information. Darlene writes, "Dear AZ friends, stay safe." Thank you. That is what we're hoping to help them do here, hoping to help them find the very latest information so that they can stay safe. All right. Sorry, these questions are coming in so fast. Are we on at a specific time? We try to jump on here at 1:30. Normally we do. Today, the county health department was giving an update. It wasn't a particularly eventful update. It just kind of was reminding everyone to wear a mask, talking to the media, asking a few questions about contact tracing. If you missed any of it, it was on just before us here on ABC 15's Facebook page, so you can go back and scroll through and watch some of the questions. It's in both English and Spanish, so that's where you can find it. Do we follow stats of hospitalizations? Raylene asks. Yep, you can find all of that on the Department of Health website. It's one of the middle icons there. Garrett, if you're able to pull it up.
Yeah, I'll pull it up. I do have there's sort of a caveat with hospitalizations. I like to make sure everyone understands. Hospitalizations, there are two curves on here that take a long time to fill up. And hospitalizations is probably the worst offender here. So as you can see, you look at this number, and if you look at this curve, you would automatically, and no one would blame you for it, look at this curve and say, oh, hospitalizations are going down dramatically. And again, no one should blame you for doing that. However, these numbers don't get filled in all the way until about 20 days or so. And so it takes them 20 days to fill this number in. And so we don't know what this number right here, June 30th, is going to look like for another 2 weeks or so. So this number could be as high as that number. We just won't know it for a while. So I don't use this to determine hospitalization in Arizona. It's just too far behind. The only thing that's good for that right now is sort of a combination of the hospitalization COVID-19 metrics and then what's called the census, which is right here. And this will show you the total number of beds in use on a daily basis, ICU, emergency department beds, and inpatient, which is basically any bed that's not marked for ICU or maternity that they can put any patient in. And these are sort of where you can go to see a more real-time situation in the hospitals. These are actually the hospital systems themselves input this data. It does not go through the AZDHS's hands. It's directly reported and then put on the system. And it is usually much more accurate than the other stuff.
Shanda writes, do we know if Doug Ducey, that is the governor of Arizona, do we know if Doug Ducey is speaking today? At this point, we have heard of no news conferences at all today. We were hoping to hear something. It's Wednesday, usually midweek we hear that. Oh, Erica asked that as well. So quite a few of you asked. We were hoping to hear something today. We're not hearing from him. As we just mentioned, we heard from the county health department, and that's the only news conference at this point that is scheduled for today. And then Harley asked about schools. Each school district is making their own assessment and making their own changes. You can find all of that information for the school district that you're looking for, Harley, on our website on abc15.com. So school at least was pushed back to August 17th here in Arizona for in-person. And they also stress that that's an aspirational date. One of the things that the governor is watching closely is the R0 number. And that is a number that you can also peek at for yourself on rt.live. And we can pull that up for you. Yesterday, what was it, about a 1.09?
It's at a 1.08 today.
08. Okay, so we're making at least a little bit of a
it's down a hundredth of a point.
Yeah, we'll take anything at this point.
I mean, yeah, with this number down 100, I mean, any movement in this number is good movement. So yeah. So
can you show where we are? This top part of the chart, this graph that you're seeing there with Garrett, is all of the states mapped out. You can see kind of where we fall here in Arizona compared to other states. The R0 number is in relation to how fast COVID-19 is spreading within our community.
And this is what you see with these error bars here. This is sort of the range. I mean, when they make an estimate like this, they're not going to sit there and bank and say, oh, it is absolutely 100% 1.08. So what they're saying is that Arizona could be anywhere between 0.87 and 1.31 in their R0. However, our best guess is that it's 1.08.
Yeah. Oh, we just got another question in. Eva asks, is there a chart for ICU bed occupancy? There is. We just took a peek at it. We have about 870 people here in Arizona in an ICU bed right at this very moment. We have about 3,000 Arizonans in the hospital for COVID-19. We've had 5,000 people in the hospital here in Arizona for COVID-19 over this pandemic. But there's a chart where Eva can actually pull this up and look at this each day if she like. How often though, Garrett, I know you've touched on this, how often does this particular chart update?
This particular chart updates every morning at about 8 to 8:15. And the beauty of this chart is these numbers rarely change. Unlike those hospitalization numbers that I showed you where it's 20 days in prior, these numbers are rarely changing from day to day. So we have a higher degree of confidence that the ICU number for July 7th is 1537. And that number is going to stay at 1537. And it's the same with the COVID-19 specific metrics, which right here, there's a much higher degree of confidence that this 871 is going to stay 871 permanently. There have been every once in a while, there are some adjustments to this site, but it's very rare when these numbers get adjusted.
So I want to teach Eva where she can find this too. This is on the Arizona Department of Health website. And then you click on, is it the hospital COVID-like icon?
So yeah, to see both of these charts, you would go to the first one is at hospital bed usage and availability. This is the census chart. And then the second one is the hospital COVID-19 specific metrics. This is where you can see actual COVID-19 suspected or positive patients.
So Eva, one of the things I always tell people on here to make it even easier is to just, once you get to this site, just bookmark it, and then you'll have it at the top of your screen, and it makes it a little bit easier to check as often as you wish. All right, we've got so many questions coming in, and I want to I want to get to all of them. I do have to anchor the 4 o'clock newscast for Faye today. We have swap shifts again on this Wednesday, so I'm gonna have to get on the set and start getting ready for that. Garrett, were there any other questions that you saw coming by that you just wanted to touch on really quick, or we might have to postpone some of them until tomorrow?
No, I see someone asked about St. Luke's right now. I mean, that's always a good question. You probably know more about that than I do, but
St. Luke's is, as far as we know from the state, ready to go. The biggest hurdle in all of it was having staff. And when Mike Pence was here, when the vice president was here, was it last week? All my days are running together already. The governor requested 500 more personnel, because one of the things was, we're saying we have enough beds, but do we have enough staff for all of this? And it takes a lot of people to help keep these COVID patients alive. That request was granted, and then how soon we can get everybody in is part of it. The one thing I want to mention with St. Luke's that we've been stressing is that St. Luke's is set up to be a step down facility. So you would go to a hospital first, and as you start to recover but still need care, would be transferred over there, is the way things stand right now. So Trudy, a really good question, and one that we'll stay on top of. But we had learned partway through this that it was worth asking, that having beds is one thing, but having people to staff them is another thing. So that's one of the questions that we've pushed for. All right. Oh, Eva, thank you. She looks forward to our info and our research. We are happy to help. That's why we're on here every single day, trying to just help you find the numbers you want. Like I said, in a newscast, we have 30 minutes or so to get through everything, and there's so much news of the day, and we know that having you be better informed and having you be able to find these numbers for yourself means that you can make the best choices for your family. You don't need us to tell you what to do. We just want to point you to the numbers, and then you can make the best choices for your family. If more questions are coming in, let's go through the ways to contact Garrett and to contact me as well. Garrett can be reached on Twitter, although he's so busy all day making graphs and charts and doing all this cool stuff and helping us visually put together the numbers for you. But Garrett's Twitter to follow along is at Garrett Archer. I'm also on Twitter at Katie Rammel, and then on Facebook, where a lot of you have joined me there, and I appreciate all of you coming from this conversation over there, and we can continue it, is facebook.com/news from Katie. And we try to keep you updated on all the very latest details. There's my Twitter account at Katie Rammel. That's the best place to reach us. And we will also be back here tomorrow with you to answer more questions, to get through even more. Usually we hop on at about 1:30. That's usually the goal. If there's, like I said, a news conference or anything else, then we have to be pushed back just a little bit, but that's okay. Topaz Dixon, you are so welcome. I hope I'm saying your name correctly. We just want to help you find the best stuff. So that's why we are so happy for you to join us here. So we're gonna wrap it up. I'm gonna get ready for the 4 o'clock newscast. We'll have the very latest at 4, 5, 6, and 10 p.m. And of course, as always, go to abc15.com/coronavirus to get all of your articles there that are specific to coronavirus here in Arizona. And as always, stay safe, everybody.